Antibiotics are considered one of the greatest discoveries in medical sciences. They have saved millions of lives and turned once deadly infection into easily treatable conditions. But today, these miracle medicines are in danger. The reason is simple yet deeply alarming: the misuse and overuse of antibiotics across our homes, hospitals, and even in agriculture. This video explains how our everyday habits are making antibiotics weaker and why this threatens the future of healthcare. Antibiotics are medicines designed specifically to fight harmful bacteria. They either kill the bacteria directly or slow down their growth long enough for the body's immune system to eliminate the infection. These medicines are powerful but also very precise. They target bacteria only, not the other microorganisms. Antibiotics do not work against viruses like common cold, flu, dengue, or COVID-19. But despite this, millions of people still take antibiotics for virus illnesses, hoping they'll get better faster. This incorrect use is one of the major reasons antibiotic resistance is spreading around the world. Misuse of antibiotics means using them in the wrong way. This includes taking them without a prescription, using leftover antibiotics from previous illness, taking the wrong dose, or stopping the treatment early just because you feel better. Overuse refers to taking antibiotics too frequently, even when they are not necessary. This is commonly seen when people insist on taking antibiotics for every fever, cough, or sore throat, even though most of these conditions are viral and will get better on their own. In many countries, antibiotics are available over the counter without proper medical guidance, making misuse even more common. When antibiotics are used the wrong way, they don't completely kill the bacteria. The few bacteria that survive learn to defend themselves. They adapt, change, and become stronger. These surviving bacteria multiply and spread, creating antibiotic-resistant bacteria, sometimes called superbugs. Every unnecessary dose of antibiotics provides superbugs with another opportunity to adapt, outsmart, and overpower the medical defenses. Once these bacteria became resistant, the same antibiotic that used to work became useless. This means infection that was once easy to treat become difficult, expensive, and sometimes impossible to cure. This resistance can spread from person to person, hospital to communities, and even from animals to humans through food and the environment. The consequences of antibiotic resistance are severe. People stay sick for longer periods and require stronger and more expensive medicines. Simple infections like ear infection, UTI, or skin infection can become complicated, requiring hospital admission. Surgeries, organ transplants, cancer treatment, and even normal childbirth depend on antibiotics to prevent infection. If antibiotics stop working, these routine medical procedures become dangerous. Drug-resistant bacteria also spread quickly within the communities and hospitals, making outbreaks harder to control. Without effective antibiotics, we risk returning to a time when minor injuries or common infection could become life-threatening. Globally, antibiotic resistance is already causing hundreds of thousands of deaths each year, and the number is rising constantly. Many people misuse antibiotics without even realizing it. Some stop taking medicines early as soon as the symptoms improve. Others save leftover pills for future illness. Many self-medicate themselves without even consulting a doctor. In some homes, antibiotics are treated like painkillers, taken for every fever, flu, or stomachache, regardless of whether they are needed or not. Misuse also happens in agriculture, where antibiotics are added to animal feed to promote their growth. This overuse in farming contributes massively to resistance, and the resistant bacteria can spread through food, water, and soil. The good news is that antibiotic resistance is preventable. Only use antibiotic when a qualified health professional prescribes them. Never pressure healthcare providers for antibiotics, and never take them for viral infection. Always complete the full course even if you start feeling better. Do not use antibiotic without consulting a healthcare professional. Never share antibiotics or keep them for future use. By using antibiotics carefully and responsibly, we can preserve their power and protect future generations. Antibiotics saved us for decades. Now it's our turn to save them.